Welcome to to this live stream video webinar. I really appreciate you being here and being patient as we work out the kinks with the sound. And just to go over things again. So I'm going to do a little bit of an introduction about myself and Step 1 Foods, and then we'll go into the resolution that we hope you can adopt this year, which is to reduce your reliance on prescription medications. And then finally, I'll be taking some questions from those of you that submit them. And I'll try to answer as many as I can during the time that we have. For those that don't get answered, I will try to answer personally in an email to you. Okay, here we go. So first of all, a little bit about me. My name is Dr. Elizabeth Klodas, and I have been in practice for over 20 years. And as a cardiologist, for the first 10 of those years, honestly, what I did was prescribe medications for everything. High cholesterol, here's a pill. High blood pressure, here's 2 pills. Without ever truly addressing what the underlying issue is, which is diet. And what I realized was that you could address the things that we prescribe pills for with changing food. And honestly, it was only when I started to do this that I was experiencing, or my patients were experiencing, cures. Medications lists were shrinking, diagnoses were melting away. And so it really brought home to me the fact that we've been treating the wrong thing. And so Step 1 Foods was invented to help make the transition from that take a pill twice a day to take a food twice a day, making it super easy to switch from being dependent on medications to relying more on food to solve the underlying health issue. Now, the resolution that we're hoping you will adopt, which is to reduce your reliance on prescription medications, is, I believe, truly realistic. It won't happen all at once. This isn't an instant fix, but with small sustained changes, you can see dramatic health effects. For example, drinking 1 can of soda a day. It doesn't seem like much, but over the course of a year, that's 30 cases of soda. And that's a lot of sugar. It's a lot of calories. If it's 120 calories per can, over the course of a year, you're going to lose 12 pounds just by doing that. Small, sustained changes make a giant difference. And the formulations behind Step 1 Foods were designed to specifically affect cholesterol and cardiovascular health, because we know, based upon hundreds, actually thousands of studies, that if you take in enough whole food fiber, omega-3 fatty acids, which are healthy fats, antioxidants from real fruits and vegetables, and plant sterols, which are natural plant components that help lower cholesterol, not only will you experience hopefully better cholesterol levels, but also lower blood sugar and better blood sugar control and weight loss, because food is a complete solution, a comprehensive solution really, to a complex problem. Okay, so now let's move on to the question and answer part of this webinar. And just a couple of little housekeeping items. So number 1, to leave a question, you can chat if you have a Google account, or you can use the link in the descriptor box to submit a question. And like I said, I'll try to answer as many as I can during this session. And then a little bit of a fun thing, everyone who registered for the live chat will be entered into a giveaway for a month of free Step 1 Foods products, and we'll send an email to the winner. Okay, so let me move on to the questions. Okay, so let's see. Here is the first one. After being on your food program for 2 months, my readings are about 10 points better in all the mentioned categories. Your food program is working for me. But the cardiologist wants me to increase the simvastatin to 10 milligrams to drop my LDL, which is the bad cholesterol, further. I'm hesitant because of my previous bout with muscle pain, myalgia. I'm not on any other meds. Your thoughts? Thank you. So first of all, I want to be very careful that I don't pretend to give out, personal medical advice. So this is all general points to take into account as you're making your decisions around your own health. First of all, the side effects of medications and statins, which simvastatin is, it's a cholesterol-lowering drug, tend to increase, the chances of those side effects tend to increase as the doses go up. So if you've had trouble with a statin in the past, keeping your dose as low as possible to get to the cholesterol levels that is desired is really ideal. Sometimes switching the statin, so instead of simvastatin, using Lipitor or Crestor, a different brand, can make all the difference in the world. After all, these medications are all chemically distinct, which is why they got a patent in the first place. So moving between statins can sometimes make a difference. But the best is as the theme of this webinar underscores, is to minimize your dependence on medication. So it's wonderful that your numbers have improved with step 1. Perhaps look and see what else you can do to improve your numbers further. Again, it's small little changes that can make a big difference. Step 1 is just 2 servings of food a day. That's it, instead of something you were eating already. Truly as easy as taking a pill. Well, maybe look at what you can change in your lunch or your dinner to increase the amount of fiber, antioxidants, and healthy fats you are consuming. Let's see, the next one. I tried taking atorvastatin, so that's another cholesterol-lowering medications, and had to stop after a few weeks because I started having muscle jerks all over my body. So this is some of this is a little bit of the same question as I just answered. Can taking CoQ10 alleviate muscle jerks? Am I a candidate for CT imaging to evaluate actual heart artery condition and decide whether or not to continue with statin alternatives? Okay, so first of all, again, this sounds like a potential statin side effect, and so you, again, want to minimize your dose of medications. The truth is, not everybody with high cholesterol requires statin medications, and you are correct to think about a CT scan as being something that could be used to determine how critical it is for you to be on a statin medication. So, a coronary calcium scan is a CT evaluation that uses very little radiation. It's actually very safe. You can even self-refer for this, but if a physician refers you for it, it's typically covered by insurance. The out-of-pocket cost is usually around $100. Anyway, what happens during the scan is you're placed in a CT scanner and you're asked to hold your breath for probably 10 or 15 seconds, and the CT scanner takes rapid pictures, 40 to 50 or so, right through the area that's your heart. And then we can look at those images and look for any calcium deposits in the heart arteries. Calcium is one of the things that deposits in heart arteries as part of the atherosclerotic process, the buildup of gunk inside our arteries. It's not the very first thing that happens, but it is part of the process, and it happens earlier than, for example, an abnormal stress test or the need for bypass surgery, something like that. So it's much earlier in the process. And the cool thing about calcium is that we can actually see it on the CT scan. And based upon thousands, actually hundreds of thousands of people that have had this type of evaluation, we know what amount of calcium to expect in your arteries. Obviously, the best result is to have nothing. And if you have no calcium in your heart arteries, you're actually at a very, very low risk of experiencing a cardiovascular event over the next 5 years. In fact, it's so low that it can't be made any better, at least meaningfully better, by making your cholesterol perfect or putting you on a bunch of drugs. So, the reason why we do all this, the reason why we put people on medications to lower cholesterol, to lower blood pressure, is not so much to make the numbers look perfect, but to reduce your risk of having a cardiovascular event. Well, if your risk is already very low, we can't improve upon that. So a calcium scan can be very useful. If you have no calcium whatsoever, boy, that really argues against having to be on statin medications. On the other hand, if you have some calcium, then it depends upon where you fall compared to your peers. Again, we know what to expect based upon your gender and age when you have the scan. If you're wildly ahead of your peers, which is not the thing you want, boy, we really would be looking for a statin-based solution, because we do know that people with people who have established coronary or vascular disease, which is what calcium in the heart arteries would indicate is present, do benefit from really aggressive risk factor modifications that typically does include statins. The CoQ10 question, because I get asked this a lot in my practice when I see patients. So the data behind CoQ10 is really meh. There's really, when you look at studies that have looked at supplements, they have been by and large incredibly disappointing. Just not much there. However, one of the reasons that it is postulated that statins cause their side effects is because they reduce the circulating levels of CoQ10 in the blood. And some people do swear by the fact that if they take CoQ10, their side effects improve or they don't have them at all. So it's not dangerous to try, and typically it's around 200 milligrams of CoQ10 per day, especially if you've had problems with statin side effects. But whether it works in you just needs to be determined individually. The data, like I said, overall is quite disappointing. Okay, the next question. What is the best regimen for reducing a statin drug while adding step 1 foods? Oh, that's a great question. So I see a lot of patients who are already on medications to lower cholesterol, and they're trying to figure out how to get off of. In fact, that's the main reason, or that's the main theme for our resolution for you this year. So it's really first adding in the step 1 foods and then seeing the response before you reduce the medication. We never advise anyone to stop or reduce their drugs without first discussing it with their physician. So that's number 1. But in terms of how to incorporate step 1 specifically, in order to try and reduce the dose of statin that you need. So what you would do is you would add step 1 foods as a substitution for something you're eating already. So 2 servings of any of our products, eaten twice per day, and for at least a month. So for at least 30 days, you want to be eating step 1 foods twice per day instead of something you're eating already. And then go in and have your cholesterol profile rechecked. If your numbers are better, meaning your LDL reduced, or they're at least the same, the next step would be to cut your, again, in conjunction with your physician, do not do this on your own, in conjunction with your physician, try to cut your dose of statin in half. And so if you were taking, let's say, 40 milligrams of simvastatin before, cut it back to 20 and repeat the process. So try step 1 foods again, twice a day as before, instead of something you're eating already, and do that for another month or 2, and now on the lower dose of statin, and go back and get your blood work rechecked and see where you're at. Is the cholesterol the same or better? If it's the same or better, keep reducing by half the dose of statin that you're taking. And again, always talk with your physician about, what is the goal for your cholesterol? How much drug do you really need? What else can you do to reduce your reliance on prescription medications? It's food, it's exercise, it's quitting smoking. That helps too. Okay. Let's see. Here's the next question. After 7 months on step 1 foods, cholesterol numbers are fantastic. Oh, I love these questions. Should I ask my primary care doctor about tapering off the meds? Yes. This is exactly as I mentioned. Think about this slow, gradual taper over time with repeated checking. This is something that can be done very scientifically and gradually and safely, but always in conjunction with your physician. Okay, let's see. From let's see, from Jean. Why aren't most physicians aware of the step 1 plan? Well, first, we're relatively new. And second, we have focused, instead of spending all our money on marketing, we actually spent all our efforts and all our resources proving the clinical validity of the formulations. So we actually did a clinical trial to the same regimen and scientific rigor that would be applied to drugs. We had patients who were unable or unwilling to take cholesterol-lowering medications, but still needed a solution, to take our foods twice per day in a free-living situation, meaning they weren't locked up in a lab. We literally just gave them a box of food and said, go ahead, eat this twice a day, whatever you choose, and come back in a month and we'll recheck your cholesterol level. And we found really highly statistically significant results, with some people experiencing 20, 30, even 40% cholesterol reductions in just 1 month. Now, not everybody has these results, but it tells you how many people can respond, and is this type of data that physicians need to get comfortable prescribing foods. Remember, they live in a world where everything that they prescribe has been studied, has been validated, has been proven to work. No one's done this with food before. It's actually amazing to me. If you go into a grocery store, typically there's about 30,000 food products that are sitting there on grocery store shelves. Not one has been actually validated through a clinical trial. So no wonder physicians don't really prescribe food. It's in a completely different level of proof than medications. So we hope to get the word out this year. 2019 is our year to communicate our findings to physicians and really toot our own horn, because we've done something no one has ever done before, and we're really proud. Okay. Have you considered non-GMO and organic for all your foods? So all our foods are actually non-GMO, so they're sourced from suppliers and that have verified all our that we don't use those types of ingredients. We actually started with organic. Trying to be organic, but honestly, it was very, very expensive and very unpredictable. Organic ingredients can be very difficult to source, and our formulas are very dependent upon the combinations of foods or ingredients that we use. So it was very important for us to have a stable supply of ingredients. But it's really not about organic or non-organic that makes the biggest choice in health. Ideally, it would be great if everything was organic. It's really going from nothing to something. And in our case, the something that we formulated is really pretty spectacular in terms of its health effects. Okay, here's one. Can you tell us more about how step 1 products were formulated to achieve the impact on LDL? Well, it turns out, we know a lot about food and its effects on health. There's literally thousands of studies that have been published. And so we actually know what to eat. We know that walnuts and oat bran and chia help to lower cholesterol. We know that fruits and vegetables are high in antioxidants, and that's really important to prevent LDL or bad cholesterol oxidation. Turns out only oxidized LDL can get into the walls of arteries and deposit there. So we want to eat a high antioxidant or anti-inflammatory diet as much as possible. So the formulations were not random. They were really based upon published science. So it's, in some sense, it's not a surprise that these foods work. What is to some extent a surprise is how well they work, even if it's just 2 times a day that you're using them. It's not a giant change in your life. You don't have to become a yoga practicing vegan triathlete to succeed at nutrition change and reduce your dependence on medication. It's about small sustained changes that you continue using food as the solution. Okay, let's see, what do we have here? What are the side effects associated with cholesterol medications? Well, first, I need to say that not everyone experiences side effects with statins or cholesterol-lowering medications. About 80% of people do just fine, but 20% do experience something, and it can be pretty unpleasant. The good news is these side effects tend to resolve when you stop the medication, but that doesn't mean that they're very fun to have if you're experiencing them. The most common thing that people notice if they have a side effect is that they get achy. And it's typically in large muscle groups or joints, and it's typically symmetrical. So shoulders, arms, back, legs. It's typically not just one sore finger that's caused by statins. And it can be very subtle, where it just takes you longer to recover from a vigorous exercise session, or it can be really debilitating, where it's frankly even hard to get out of bed because you're so sore. Sometimes it's hard to know whether that muscle soreness is related to the medication or to something you're doing. After all, if you pick up a new exercise routine, which a lot of us do, especially this time of the year, are you sore because you're doing something you've never done before or not used to doing, or are you sore because you're on a drug? Sometimes it takes stopping and starting the medication to figure out what's what. Typically, muscle aches get better after about a week or so of being off of the medications. Typically should be gone entirely by a couple of weeks after stopping. People vary a little bit, but those are some general guidelines. There's other side effects as well. So uncommon, but I've seen this in my practice, is that people complain that their cognitive function has changed. So they're not quite as sharp. They can't do math anymore. They forget things more. There's even been some dramatic case reports where people were actually felt to have developed dementia and were being, were being geared to be taken to a nursing home, and then the medication was stopped, and people became their old self again. Very, very, very rare for it to be that dramatic, but the cognitive changes are real, and I have seen this. Again, they get better when you stop the medication. It's important to know that actually, on balance, the data for statins is positive in terms of their reducing the risk of dementia overall, probably because they reduce the risk of stroke. There's also a liver side effect, where you can see the liver function tests become abnormal. That's not something you would feel. It's something we would pick up with a blood test. And so that's why, in general, we at least check your liver function tests a couple of times while you're taking the medications to make sure your liver function tests are staying normal. Again, these tend to get better when we stop the medication. And finally, there is a known increased risk of developing diabetes when you take statin drugs. But this is more difficult to define, which is the problem, because a lot of people who require statin medications, unfortunately, are also people who are at risk for developing diabetes, because they're more likely to be overweight, to eat poorly, to not exercise. So all of those things could be contributors to the higher risk of diabetes. But it seems to be, even above and beyond what you'd expect. In general, the medical community feels that the risk of developing diabetes is far outweighed by the benefit of the risk reduction for cardiovascular disease. But still, if you can minimize your dose, if you can reduce your dependence on these drugs, that's always better, because the chance of developing any of these side effects is going to be lower. Okay, let's see. What is a better New Year's resolution? Improving your diet or exercising more? Okay, that's a great question. So the impact of food, if you're going to choose one thing, I would hope you would do both. But if you're going to choose one thing, the impact of food is so much greater than the impact of exercise, because we have to eat. We have to do that every single day. So everything everything we put into our body has a biochemical effect. So if you can make small changes in an activity that you must do multiple times a day, the health effects of that are tremendous. Exercise is great. We can survive without doing exercise. That doesn't mean it's not the right thing to do, but the health benefits from food, because it's such a repetitive thing that we do, and because we do it multiple times a day, is really very cumulative and very quickly seen. Oh, and the last one is, that I'll try to cover, should I stop taking my medications? Please don't stop your medications without discussing your particular health situation and the need for those medications with your physician. However, that doesn't mean you shouldn't periodically do a review of all the medications that you're on. Why are you taking these? What are they supposed to do? How can you minimize your need for these by changing or modifying how you live? The people who live long well do so not because they're on the perfect combination of a bunch of drugs. They live long well because they live well. And so that is my biggest message to you. It is how we live that really impacts our outcomes, our risks, and our health. And so we hope that you look at Step 1 Foods as a resource for helping you to get to these goals, because we're here. The whole reason for this entire endeavor is to help people achieve their best health through the way we should be doing it, which is through diet and the way we live. Thank you so much for joining us. And again, I see there's more questions here, and I'm sorry I haven't been able to get to all of them. I will try to answer them individually to you via email. And let us know if you enjoyed this format. It's the first time we've done it. If you like this format, I would be excited to continue doing this series. My career is all about helping people, and I feel that with Step 1 Foods, I've been able to do that and affect the most lives. Thank you so much. Happy New Year.